we have about 172 different accents in the operating room within the UAE only. So I think the variation of accents is very important when it comes to building a system that can accommodate all these different accents.
Welcome to the Health Beats podcast, brought to you by the inaugural Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We're giving you insights into the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, I'm joined by Abbes Seqquet, president of Rain Technologies Incorporated, the company behind Orva, the OR voice assistant. Our conversation today is entitled The Voice-Powered Operating Room, Surgery's Next AI Frontier. Abbes, welcome to the podcast.
Thank you very much, Lara. Thanks for having me.
You have been in AI for more than a decade. You were really there at the start of this uptick. You chose healthcare. You chose revolutionizing operating rooms and surgery in particular. How did you get to that point, and what are you trying to achieve now with your technology?
I've been in AI for over a decade. So I started with IBM Watson in 2012. I think that IBM Watson was a business unit that created the AI economy back then. I have to admit there have been a lot of ups and downs for the technology, but today we are at a turning point where I think that moving forward, companies would not have to choose whether to use AI or not, but rather when to use AI, because it is becoming one of the competitive differentiators in today's world. So that's, across industry. Speaking of healthcare, and as you mentioned, I've seen the evolution of AI and I've seen how it has disrupted multiple industries. Unfortunately, healthcare has not leveraged the benefits and has not reaped the fruits of what AI can provide, starting from improving operational efficiencies all the way into identifying new revenue streams. So I think and I hope that today we can shed some light on how Orva can help hospitals of the future leverage the technology in order to advance their noble mission.
Surgery operating rooms, we think of these as really theaters of human talent. So what was it that was inefficient about surgery as we know it that you wanted to apply AI to revolutionize?
Absolutely. That's a great question, Lara. And in fact, it's not so much the surgeries that were inefficient, but rather the operating theaters. Today, if you've been to an OT or an OR, an operating room, communication and coordination is lacking. Poor communication between members within the OR team, people like surgeons, nurses, anesthesiologists, staff, support staff members can and usually results in delays, disruptions during the surgical procedures. I think with Orva, what we're trying to do is create a clear and effective communication channel to ensure that patient safety is at the highest priority for the medical staff, and more importantly, optimize workflow efficiency. So this is, I think, from a communication and coordination perspective, there is a lot of room for improvement. There's also a lot of room of improvement in the patient flow and turnover time. Today, hospitals are unable to manage patient flow and turnover time between surgical cases, and that leads into increased wait time for patients, which impacts their patient experience negatively, and also decrease the OR throughput. As much as we know that hospitals play a noble mission in everybody's life, they remain for-profit organizations that have revenue objectives and revenue targets. So I think with optimizing the patient flow and the turnover time, I think this will enable hospitals to become more profitable, at the same time provide an experience that is more pleasant to their patients.
What does AI do to solve those problems, specifically the communication flow, the patient turnover? What are the shortcuts or the efficiencies that it can create?
So I guess hands-free communication plays a huge role in the OR. Today, the OR is a very high pressure, high stress environment that requires a lot of coordination between different team members. The role of voice AI or the hands-free voice AI is to enable communication between the different team members without the need to touch the device or type a message. And this is very important. I think it represents a huge opportunity for hospitals to leverage this technology in order to encourage their staff members or their physicians, clinicians, and OR staff members to be generic, to focus on quality of care. Keep in mind that ORs or OTs are sterile environments and they have requirements to remain sterile. So any touch of a tool or any type in may compromise the infection control measures, which may have some implications on the quality of care provided. I think voice being a natural way of interaction makes the real-time updates and alerts very natural, which means that all the different staff members, all the different OR staff members can interact amongst themselves and update systems on the fly that will help them optimize the updates and at the same time pay attention to the different alerts that are important within a surgery.
What were they doing before AI kicked in? Who were they trying to communicate with? What were they asking for? What's the pre-AI version of this?
The pre-AI of this, Lara, is that within a surgery from the World Health Organization, the World Health Organization has designed or has divided every surgery into multiple milestones. These milestones are very important to track in order to track where things go right and where things go wrong. God forbid, right? So in pre-AI, there were nurses and clinicians documenting these milestones either in bloody napkins or in their gloves, or sometimes they were writing these milestones on their skin. This is how, I guess, unstructured this process was. And every time you do that, you're taking your attention away from the patient, which provides risk and creates risk. But more importantly, the majority of this data that is very critical and there is, very compliance heavy, gets lost at the end of the surgery. So what happens is that the medical staff ends up making up these milestones, and these milestones come with important timestamps that need to be retraceable. So what used to happen and continues to happen for hospitals that do not leverage this capability is that either the data is lost, or when it's not lost, it is documented post-operation, which means that post-fact, which makes it either inaccurate or beyond when it was supposed to be registered. If I may, one more point that is very important and where our value proposition plays is the documentation and reporting. Because remember that throughout the surgery, surgeons are documenting what's happening within the surgery. All this documentation is something that today is being done through, I guess, verbal communication with nurses that are supposed to remember this 2 hours after, the information is transmitted. And I think that creates a level of, I would call it data breach or possibility of data loss within the surgeries.
It's very interesting. We've heard a lot on this podcast about data and healthcare, but never about the data from the operating room. And if it's your surgery, certainly you want to know what happened when and how it went. Are you hopeful that that sort of data capture is going to change surgery, change something about the way we succeed in surgical contexts?
Absolutely, because I think that today our first aim is to capture this data and to document this data and make sure that this data is accurate. So this is our first aim. The next step would be to take this data, analyze it, and make sense out of it in multiple facets. The first one would be, how can we learn from previous surgeries based on the data available? This is one. Second, how can we provide better quality of care based on the procedures that are being followed by by hospitals, by clinicians. And thirdly, which is the most important one, is how can we leverage this data into making better clinicians let me not say better clinicians, but clinicians that make less mistakes. Unfortunately, this is part of the job, and we all recognize that. But I guess as we're starting to develop some clinical decision support systems, I guess mistakes will be less and less, and this is the intention in revolutionizing how healthcare is provided in the 22nd century.
And patient workflow, getting patients in and out of the operating room. How is Orva changing that?
70% of hospitals' revenue today comes from the operating room, which makes the operating rooms the revenue engine of the majority of hospitals. A minute at the operating room from an operating cost perspective is about $178. This is here in the UAE. This is a local benchmark, but it's reflective of how precious time in the operating room is. The other thing that we need to keep in mind is that the average time lost per delay is about 60 minutes, and 61% of all surgical procedures experience a delay. If you put all this into one equation, it leads you to believe that, every minute that we are not leveraging the OR efficiently we're losing revenue. And this is where we come into play. We come in to actually inform the hospital management on how they can leverage their operating rooms as efficiently as possible, how they can turn around these operating rooms as fast as possible without compromising the quality of care they deliver.
What are some of the technical hurdles to applying this technology in the operating room? Ambient noise, voice variations, accents. What are the challenges to making this successful?
So I think you mentioned most of them. The first one is, especially in this region, keep in mind that we have about 172 different accents in the operating room within the UAE only. So I think the variation of accents is very important when it comes to building a system that can accommodate all these different accents. There's also this concept of medical jargon that you need to teach a system. You need to teach an ASR, which stands for an automatic speech recognition system that will understand not only the different accents, but also the different jargons. The other thing from a technical perspective is integration. Hospitals have always been known of minimal technology integration, which means that they have disparate systems that do not necessarily speak to each other, do not integrate with each other. I think adding another layer of complexity being voice, while it provides a lot of value, represents a technical challenge. So I think I've listed the most important ones, but happy to dive into any of them as you see fit.
It's a stressful environment. Are there additional adaptations you need to make from a UI/UX perspective, given how much pressure people are under in these environments when they're interfacing with the AI?
Absolutely. I think our aim is to build a platform, a technology platform that is simple and that is clear. Speech is natural, so luckily we do not have to train anybody on speech. But we need to make the application very simple and getting access to this application very clear. I think one of the big challenges is the context. Platforms, AI platforms need to be context aware. And this is something that we're playing a huge role in creating values and tapping into an area that is very complex, which is how can you provide relevant prompts, feedbacks, and assistant based on the current context, which is very, very important, ensuring that the voice command and the responses are exactly what the user is expecting. We're also introducing a capability which has to do with feedback and confirmation. So as the medical staff or the OR medical staff interact with the voice platform, they are getting confirmation on what the voice platform has captured to make sure that it is capturing the right data and the accurate data. Of course, there's an aspect of natural language understanding which is very important, that we're helping the medical staff understand that this is a probabilistic system. So this is a system that is not deterministic. It is not a system that will always have it right, but will have it right 98% of the time. And the 2% of the time that they will not have it right, you will have a confidence level of the system that is low, that will help you make the decision not to move forward with the decision that the platform is recommending. So I think these are some of the areas that have to do with the UI, UX to improve adoption.
It's a fascinating use case. This is going to refine a lot of the human computer interaction models that are out there. If it can work here, it can work in a lot of other stressful situations. How about other fields, other ways this works after you've used it in the operating room? Are there more opportunities when it comes to training for surgeons, remote collaboration, even in the course of a given surgery, knowledge sharing? Where else can this go?
Yeah, absolutely, Lara. So today, while our initial release will be around, coordination, later releases will focus on areas such as continuous medical education, CME. We all know that today, you and I, if we ever have to go to the OR, God forbid, we would opt for the most experienced surgeon, right? I think that gives us the sense that we're in between good, safe hands, given the expertise that the surgeon has. However, research has shown that the more experience the surgeon has, the far off they become from the modern best practices. And I think this is where CME comes to play heavily, is that we want to introduce some continuous medical education modules that will help in, I would say, upskill or augment the capabilities of experienced surgeons, especially based on the latest methodologies, the latest best practices, that we're having some very in-depth collaboration partnerships with some of the most renowned medical journal providers that will help us do that. So this is in relationship to the CME, or the continuous medical education. As you rightly mentioned, today with the advancements of the technology, I think that we will see more and more collaboration cross borders and cross continents when it comes to the medical space and to surgeries. So I guess virtual reality and virtual training and simulation will become a major part of the enablement, I would say, workflow of, or the journey of every surgeon. So today, a surgeon here or a resident that lives here in Dubai could attend a live surgery in Boston. And this is enabled through the virtual training and simulation capabilities, mainly enabled by virtual reality, by voice AI, among other technologies. The other one would be interactive learning modules, where voice-enabled interactive learning modules can provide surgeons and trainees with on-demand access to, could be procedural guidelines, that could be reference materials, it could be instructional videos sometimes, So surgeons can navigate through learning modules, interact with the technology or the platform, receive explanations using voice commands. And I think this is where we want to take the platform, is to an area where it becomes the surgeon's best friend.
This is very interesting. From data to insights to training to surgery in the metaverse to wherever else. Do you see a day where AI itself is coaching surgeons in the course of an active surgery in the operating room?
I still remain a big believer that AI will never, play a higher value role than a human being. And in this case, so much so because surgeons are very highly skilled folks that will continue to lead the way. However, where I see AI going is complementing their capabilities and replacing the mundane tasks that surgeons shouldn't be doing, or the OR medical staff shouldn't be doing. So I think this is where I ultimately see artificial intelligence augmenting the OR medical staff capabilities and helping them streamline and ease up all the mundane tasks that they do on a daily basis. So I guess coaching could be part of it. I would say cross-checking and bouncing back ideas would be, I guess, a better approach than coaching. The surgeon will always lead the way. I think AI should help these surgeons do things better, do things more efficiently, and with the goal to provide a better quality of care for you and I as patients.
What's your take on data privacy, data security, data rights, and all the implications of voice technology when it comes to accessing protected health information from these surgeries?
Yeah, so I think this is a subject that is not necessarily related to voice AI as much as it is related to AI in general. So I think today everything we're building it in a healthcare certified framework to make sure that we abide by all the DOH, I would say, guidance. So this is from a platform perspective. Of course, we are putting in place all the guidelines and frameworks to make sure that from a patient perspective, patients are aware and give us approval, I guess, or the thumbs up to capture that data, to use it in a way that is aligned with what the patient wants to use it for. I also think that moving forward, as AI becomes more and more prevalent in hospitals, this is a subject that we need to take more seriously, because at the end of the day, beyond the consents that we get from patients, beyond the enablement and discussions that we have with patients to make sure that they're okay with us capturing this data, I think there's an aspect of cybersecurity that not a lot of people are thinking about, which is linked to how can we avoid attacks, cyber attacks that will have access to very sensitive data. So again, we are building this platform as securely as we can, following the latest and greatest security guidelines, and working with some of the most advanced technologies and vendors that will provide us this safety net.
What's your thinking or your experience in how stakeholders adopt this technology? How do they get used to this whole new way of doing things? Surgeons, nurses, administrators, vendors, how do you imagine bringing them on board to doing things through voice AI?
This is the one, I would say, the $1 billion question, not a $1 million question, but a $1 billion question, because successful adoption in voice technology in the OR requires a lot of collaboration and buy-in from multiple stakeholders, as you mentioned, from the surgeon to the nurse to the anesthesiologist to the administrator, the COO, the operation person, to the information technology department within that hospital, and to all the way into the healthcare tech ecosystem, which is us, which are the vendors, the ISVs, the independent software vendors, all the way into the patient. So I think every single one of these stakeholders needs a certain level of buy-in, because successful adoption relies on multiple factors and multiple players. Surgeons need to buy in and need to see the value, and this is what we're working on a daily basis, is to highlight and shed the value of voice AI and Orva to the surgeons, to the nurses, to the anesthesiologists that need to document many things that today are not being documented due to the lack of easy to access interfaces, all the way into the IT department of a hospital that needs to maintain this technology, that needs to see the value of why they will continue to maintain this technology and make it better. And to us who will continue to evolve this technology and will continue to provide, not only value add services, but ways to disrupt the way things are being done today. Lastly, the patient plays a huge role, because what we're aiming for is to provide a personalized OR experience for a patient that is more likely than not feeling well as they're going into the OR. So I think providing the patient with some type of personalization and excellent patient experience is what we're aiming for in the near term.
You came from the world of deep technology into the world of healthcare. So you have this very interesting, fresh view From that perspective, in 10 words or less, what do you think is the biggest challenge facing the future of healthcare?
Risk taking. It's not 10 words, it's two, but let me explain. Let me elaborate. I think hospitals have always been conservative in risk taking because a lot is at stake. But so was the airline industry that I helped digitize in a couple of years of my life. And I think it starts somewhere. We hope that Orva sheds some benefits and highlights some value that is untapped today to hospitals where they can see a voice AI and AI in general expand into their operations. As I mentioned to begin, we're targeting operational efficiencies improvement, but we're aiming for helping hospitals identify new revenue streams, providing a better quality of care, which is the philanthropic objective of RAIN as an organization.
Abbes, this was fascinating. Thank you so much for joining us.
My pleasure. It was a great pleasure talking to you and meeting you, Lara, and hope to see you at the conference.
Thanks for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. And if you're interested in talking more with us, you can join us at Abu Dhabi Global Healthcare Week, taking place from May 13th to 15th at ADNEC Abu Dhabi in the United Arab Emirates. Thanks for listening. You can like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.